right, welcome to this week's episode of the podcast. Today we are talking about advocacy with Dr. Leslie Golden. This is Obesity Week, so it is the perfect time to talk about some of the challenges people who struggle with their weight face and what we can do about it. Dr. Leslie Golden, MD, MPH, is a board-certified family medicine and obesity medicine physician. She uses her medical expertise in combination with her graduate level training in behavior change to help patients manage the disease of obesity and the diseases associated with it. She also teaches family medicine residents from the University of Wisconsin. She's passionate about increasing the awareness of metabolic weight and as a member of the Obesity Medicine Association's advocacy committee, as well as creating the Wisconsin Obesity Society. So welcome, Dr. Golden.
Thank you for having me. Glad to be here.
So tell us a little bit about your background. How did you get interested in helping people with their weight?
Yeah, so I started out my training in family medicine, really loving that patient-physician relationship, feeling like I really would have impact in that way. And you definitely do, but I noticed as I worked with a lot of patients, diabetes, high blood pressure, sleep apnea, that there was often a core problem, the weight related conditions that really worsen a lot of these conditions that we take care of in family medicine. And I didn't quite have the time I felt like I needed to address that. But when I pivoted over to spending that time, I felt like I was really having that impact that I always wanted to have, like really having that change with that patient and seeing how it changed their quality of life, to focus on helping them achieve the weight health and seeing a lot of these other conditions finally become very well managed without medication, which was always so exciting. And I feel like once you get that bug, once you have those positive experiences with those patients, it's really hard to pass it up. And it almost changed for me because more and more patients were coming along to be treated for weight, and I just kind of ran out of room for primary care to where it just took over my practice.
Yeah. But I think at the same time, so much of what we do when we treat weight and we treat metabolic health is like the core of primary care, right? So instead of waiting for our patients to get diabetes or have a heart attack or not be able to, play with their grandkids, we're doing, the using the tools, doing the work with our patients beforehand. So I think it's such an essential part of primary care that is often just completely, missed out on.
It really is, because that motivation, that prevention, that disease prevention, and really promoting full spectrum wellness is missed in primary care now because it's so focused on those acute illnesses when really the chronic diseases are what we see so much of.
Yeah. So there's a lot that kind of prevents people from getting access to this type of care from seeing a doctor like you or me. And I think we are going to kind of dive into like what some of those reasons are today and what we as physicians, but what our patients, what the public can kind of do about this. I think probably the first thing is just understanding it, right? So in the podcast before, I have talked about, really treating weight as a medical problem, right? That it is not someone's fault. There's a lot of biology that is the reason behind why some people struggle more with their weight. And it seems to me like that's like our first step, right? Is recognizing that this is not really in people's control. So I just want to like make sure I say that before we go any farther with the conversation. But, there is so much bias against weight and obesity in our society. What are some examples of that we're encountering as physicians and as people on a regular basis? Like, where are some of these biases that some people may not even recognize as a bias?
Yeah, I think it's everywhere, which makes it almost hard to notice sometimes. I mean, we have the very obvious examples of it, like childhood bullying. when children are struggling with their weight, and they're not picked to participate in things, or they're actively being bullied in school. I mean, that's a pretty obvious one. But then we have really subtle ones where family members making comments about activities that, oh, I didn't realize you could do that because of your weight, or
Right. Like this
maybe you
assumption that
shouldn't eat
someone
that
may not be
because
able
of
to
your
do
weight.
something based on their weight, which is
Mm-hmm.
just, kind of ridiculous.
Mm-hmm.
Yeah.
Yeah, I think, in the media recently, there was some advertisements about people of all different sizes engaging in fitness. And there was this backlash in the media about whether or not patients of or people of different sizes are actually fit. And so this idea that you have to have a certain body size to be fit, and those two ideas really don't go together. And we often don't think of the reverse. Just because someone may be in a smaller size body doesn't mean they're healthy and fit either.
Totally. So
So
I'm a CrossFit coach a little bit in my spare time. And CrossFit is one of those things where having more muscle mass, having a bigger body sometimes is a huge asset, when you're going to lift weight or do powerful movements. And so I've definitely seen people come in who just are so fit, such beasts at different sizes. And then sometimes we have a new person come in and they're very lean, they're small, they would fit with society's expectation of a fit person, but they haven't worked out in like years, and like they are short of breath and dying 2 minutes into the workout. And so there's like this bias, right? You see someone with a, what we think of as a fit body type, but it's just a thinner body type, right? It's a smaller frame, a smaller
right.
person. That doesn't mean they're necessarily going to be better at activity. And then, sometimes we see someone who, has extra weight, and we assume there's these assumptions in society that person isn't fit, and that's completely ridiculous. Did you ever see, this was like years ago, but it made a huge impression on me. It was in like Sports Illustrated or something. It was like a picture of all the different Olympic athletes and their body sizes, and just the variety of shape and muscle and height. And some sports, of course, work better for certain body types, but it was just like amazing to see the differences in the human body and like what our body, can do in all different shapes. So yeah, those are like some
That's
really
a
good
great.
examples.
Yeah. And I know I experienced it even myself with cycling, because I love being outdoors cycling. I'll participate in events traveling across the state. And within these large groups, I would encounter these interactions of people assuming that some of us are not cyclists simply because we don't have this very lean frame, this small frame. So it is interesting that stigma and the bias that we see. I think one of the worst things is the internalized bias,
Yes.
because when we talk about the barriers to care for patients, the negative ideas we have about ourselves that we've adopted, where we believe and buy into the fact that it's our fault, can really get in the way of people seeking care, or struggling with being successful long term. I know I see that a lot in my practice. I'm sure you do, where
Absolutely.
I have to be the one convincing someone, hey, it really isn't your fault. This really is a disease. And even after a little while of buying into it, when struggles start to come up, as they will, reminding them again, because we start to beat up of like, oh, I should try harder. I'm not
Yeah.
trying hard enough, right?
Yeah.
And it's really oversimplified in thinking that it's as simple as eat less and move more. But it's hard for people to get past that idea that it's that simple.
Yeah, I think, letting go and recognizing those internal biases are the first thing. And so internal bias, right, is when we think that about ourselves, right? Maybe we think that thinner is better, or we think that we are not able to do something based on, other perceptions of weight. And letting go of that is really huge, because we can't change other people. We can do advocacy. We can advocate for ourselves. We can do things, but we can change ourselves and how we react to things. And it's really hard to be successful long-term with your health if you don't believe in yourself and you don't trust yourself, and you're beating yourself up all the time. I actually had this huge mind-opening experience about weight bias myself probably about 7 or 8 years ago. And, this is something I did a lot of work on for myself when I started helping people is, letting go of this idea that thin is better, because I do think people can be healthy at all different weights. And, as a physician, I certainly see people who have a normal weight, a normal BMI, and they are not healthy, right? Like we see that all the time. There's no guarantee that just because you're a normal weight, you are healthy. And I was at this event with a bunch of professional women. And there was this woman I didn't know very well, but I kind of knew a little bit about her. And I saw her and she looked really thin and her hair looked amazing. And for like 3 seconds, I was like, oh my gosh, like, so-and-so looks amazing. And then I remembered that so-and-so had recently been diagnosed with breast cancer. And the reason she was so thin is probably because she was on chemo. And the reason her hair looked amazing was that it was a wig. And I just was flooded with all these emotions of like, oh my gosh, like that's where your brain went. You saw someone who had lost weight and you thought, wow, look at her. She's so healthy. Reality, that woman was sick. She was getting chemo. She was fighting for her life. That's why she had lost weight. And that was one of my huge aha moments that, I still had this bias that like thinner was better. And I think, the more we can recognize that and find those times where we find that thought pattern happening for ourselves, beating ourselves up about our weight, thinking we're not worthy of something. How often do you see that? I have people who come in and they say they feel like they can't go on a beach vacation because of their weight. Like, what are you talking about? Right? People start talking in a couple months here about beach bodies, right? Like everybody's a beach body, right? Like all of us can go to the beach. It doesn't matter what our shape is. So like getting rid of some of this negative self-talk. How can we help? Like if you find yourself having this negative self-talk or, finding yourself thinking like thinner is better, how do you suggest people, get rid of that internal chatter and get rid of that internal bias?
Yeah, it's such a difficult barrier for a lot of us to get past. And I like that example you gave about that weight bias in a different way, because it's a good point that not all weight loss is healthy weight loss. But when we have those negative ideas and negative chatter, I really try my best to try to focus people back on what are we experiencing along the journey that is helping us. We have this idea that when we get to this certain weight, whatever that number is, we always have this magic number, and we feel like we're going to arrive there and everything we've ever wanted is just going to be there waiting for us. We're going to feel amazing. We're going to love ourselves. It's going to be easy from then on. And we often, if we haven't done the work along the way, we get there and a lot of us are like, well, what happened? Like the weight is here, but I don't feel amazing. So I try to remind patients of that experience and work on the things that make us feel great about ourselves along the way. Whether it's the energy we feel, how much better we sleep, how much stronger we are, and really start to focus on those positives of the journey and give themselves a lot of grace along the way.
Yeah. Yeah. And I think it's like recognizing it, right? Are you getting yourself tied to a number or tied to an idea that you can't do something, you shouldn't do something, and recognizing it, right? Like, wait, why do I think I can't go to the beach? Why do I think I can't go to this fitness class? Like that's ridiculous, right? So yeah, I think that it is a work for all of us, especially like women, in our culture. Like we just, we've been taught so many negative things about our bodies in general. So letting that go is the first step, like for ourselves.
Yeah.
Um,
Yeah. And starting to live that life every day and realizing you can enjoy it. Like buy an expensive pair of jeans now and wear them and enjoy them. That idea of when I get to this size, I'll
yes,
buy this type of
yes,
jeans, or I'll buy that kind of dress, or I'll go on vacation when, or I'll start dating when.
yep.
And it's get out there and experience it. Do those things that could possibly be on your list. Try it now and be active in your life now, rather than waiting for this magic number
Yeah.
to start
So
enjoying your
don't
life.
let your weight or your perception of your weight, right, limit you is what I'm hearing, right? Like don't let your weight limit you, and don't let your perception, because sometimes it is a perception, right? It's not even an
Mm-hmm.
actual problem. One of the places, and I
Yeah,
hear this
yeah.
from my patients a lot, and it like, kind of breaks my heart that we see a lot of bias is in healthcare. So, I have patients who will describe going to another physician in the past for like knee pain, and they're really not evaluated and they're just told like lose some weight. And when I hear that, I'm always like, okay, well, like everyone can have knee pain, right? Like, like, yeah, maybe losing weight would help, but we need to evaluate it first, right? Like, do you have a torn meniscus?
Right.
Like, your weight doesn't care if you have a torn meniscus. Do you have a torn ACL? Your weight doesn't care, right? So, or patients who maybe were, doing a specific diet that was working for them, and they were really dismissed by a clinician, a healthcare worker of some sort, that wasn't a good fit. So there's a lot of bias in healthcare. Do you have anything that you've seen, or what can we do, and what can patients do to advocate for themselves if they feel like they're experiencing bias around their weight?
It's one of the worst parts, I think, within the bias concern of what we see within healthcare. I think studies have shown that at least half of healthcare providers have exhibited some type of weight bias when asked. It may be even higher. But it can be as simple as I I see it, when dismissing a patient's progress with certain diets. I've definitely seen it where patients are given advice that they need to lose weight without even getting a history, not realizing that the
So
patient
what
may
what would
already
you
be weight
recommend
reduced.
a patient do if they are, let's say they are doing a meal plan, and whether it's meal replacement or plant-based or Mediterranean, whatever it is, keto, they're
Yeah.
excited about it. They have lost some weight, they feel like they're having progress, and they get dismissed, or they have a complaint and they're getting dismissed. How can they, navigate that with their healthcare provider?
I think it's important to have that conversation back with them of, I've tried these other things. This works for me. This has been successful for me. And I'd like to at least try it. Can you work with me? Can this be a team approach of giving me some guidance with this specific approach? Because there really isn't a, a right or wrong way. There is no one way to lose weight for many people. And if a method really is working for someone, it's important for them to be able to have the support they need to try it, right? So really asking that provider just to be willing to collaborate a little more with them or see it out.
Yeah. Yeah. Just sort of, stay open-ended, be like, well, I think it's worked for me, or, this is my goal. My goal is to lose 5%, or my goal is to improve my hemoglobin A1C, or, improve my blood pressure. Like, let's just see if I can do it. Right.
Mm-hmm.
Yeah. And there are places too where you can find, physicians who maybe are certified too in, like obesity medicine, or there's a movement that sometimes can get a little extreme, but has also some great directions called health at every size. So there's some, physicians
Mm-hmm.
who are part of that movement. So sometimes it's like, you have to have someone who supports you too, if that collaborative approach really isn't working, which I see so often for patients. One of the exciting tools we have in our field is medications. and
Mhm.
they're super helpful for weight loss. And I'd love to hear, your take on why medicines are helpful. Let's just start there. Like tell us a little bit about, anti-obesity medications and why they are an important part of your practice.
So I I find that they are very helpful for patients that have struggled with their weight, either for years off and on, weight cycled many times, or just haven't quite had the success that they want with lifestyle changes. I think there's this misunderstanding that the medications can just be magic, and we don't have to work and make different changes along with them, because the medications are so valuable in that they balance a lot of the hormonal dysregulation that patients have that have led up to. I should probably start over on that. Can we cut that and start back
Sure.
over? Usually, I
Sure.
was getting lost in that one. Usually they can, right? In the
Yeah, yeah.
podcast.
We should be fine.
Yeah. Sorry. All right. So start over with your asking your question about
Okay.
why I
Yeah.
use medicines.
So Dr. Golden, can you tell us a little bit about your experience with anti-obesity medications and why those are helpful to your patients and when, maybe you use them?
I use a lot of anti-obesity medications. I think they're one of the great tools that we have. We use so many different tools to treat patients, along with the lifestyle, but patients often get better results when we use the anti-obesity medications, and especially if we're able to find ones that work really well for them. It's really unfortunate. I feel like there's a lot of negative information out there about them, which is really getting in the way for some patients of being able to use them to their advantage.
Yeah. Yeah. I have a whole podcast episode that goes into all the details on medication. So make sure to check that out if you haven't, if you're wanting to learn about what options exist. But right now, a few of them have started to become sort of a big deal on social media. We're hearing lots about Wegovy and then some similar medications that are sometimes used for weight that are not, technically approved for weight, like Mounjaro and Ozempic, but really in the same field of medicines. And there's just so much drama on social media about these medications.
Mhm.
What do you think about that? Why are we reacting negatively to these medications that are so life-changing for people?
I think in a lot of ways it goes back to the bias. It's the misunderstanding. For decades there's been this accepted idea that you just need to simply move more, eat less, try harder, and the education for the community still hasn't quite gotten out there enough to where I think there's enough of an understanding that this is a disease state, and that it is very normal for patients to need pharmaceutical medication support, just like in any other disease. We know that as we have some success, the body fights back. And without these medicines, it can be really hard for people to be able to push past that. And I think just the misunderstanding of the process of weight regulation guides a lot of that, as well as just the cost.
The
I
cost,
think I
right? Yeah,
think
the
the
cost
cost.
is huge for some of the newer medications, right? A lot of the new medications are really, really expensive. So this is something you and I have done some of advocacy work around is trying to improve coverage of these medications because the newer medications, if insurance is not covering them for the average person, the cost is too much to pay out of pocket. So, there are some great things that are happening. There is, if we can put this link on the show notes, but the Obesity Advocacy Coalition, they have a way that you can send a letter to your congressman and senator to support something called the Treat and Reduce Obesity Act, which would help cover these medications for people with Medicare, which would be a great first step. But yeah, the meds are not always covered by insurance. In fact, I think on average, they're not covered by insurance right now. So, I mentioned that link. We'll put it in the show notes. What other things can, someone listening to this who's frustrated do to maybe get access to these medications and improve coverage for these medications?
I often encourage patients, first ask your provider for prescriptions for them, ask to be treated. That's always the first thing. If you don't have coverage for them, you can go to your employer, because a lot of these plans are employer decided additional packages, and it may be a situation where your health insurance may offer it, but your employer needs to add on that specific package that covers the medication. So that's
Right. So
one
what you're
step that
saying
they
is
can
like
try
there
to.
are some things our insurance is required to cover. So if I, get breast cancer, insurance is required to cover certain things for that treatment. But weight is not something that, insurance companies are required to cover. And so certain plans will cover it and certain won't. And it's really the employer that, has to decide if they want that extra coverage. And they may not even know that they're not covering that, right? Because there's so many different options they have. So, sorry, what were you saying? How can a patient who's not getting access to these medications, what can they do?
Go to their employer's human resources department and ask if they could consider adding these medications on to their to their plan, because it's not considered an essential health benefit, even though
they're not required. Yes, you and I both think they're essential, but it's not. No one is requiring the insurance to offer these medications, but they can. And again, sometimes you can ask your HR department, if they can do that. And then there are some other medications, that are super affordable. They're just not the ones that are super buzzworthy right now, and all over social media. So, I like that you said ask your clinician, ask your doctor, whoever you see for primary care, if these medications are something they're familiar with. I have lots of tools online for doctors. So if they want to learn more about these medications, your doctor can check out my website, helpyourpatientsLoseWeight.com. And I have, a whole hour-long lecture so they can learn about these meds. But yeah, I think asking, right? Like recognizing like, my weight is not my fault, and there may be biology that's kept me from being successful, and maybe there is a tool like a medicine. And if you are hearing some negative things out in the world about these medications, like, recognizing that a lot of that comes from a place of bias.
And I think it's a great point of the other options. There's been so much media coverage because these new medications are very successful, but we've had tools in terms of medications to help us treat obesity for a long time that do give good results. I definitely have patients that have had significant results with medications that aren't these buzz meds that are out there now. Yeah. So I really encourage individuals that if you're struggling with this, but you've already been told that you don't have coverage, don't give up. Still go and talk to your provider, because there are probably other options that you may be able to afford, just because some of these high dollar meds may not be within
the newest med is not the only meds, right? Like we do have other tools in our toolkit. Well, any final thoughts, Dr. Golden, as we sort of wrap up for Obesity Week here, talking about, bias and stigma and what we can do as individuals to kind of break that down and improve access to care. Any final thoughts for us?
I think in general, I would just start with the basics. As we look at this week as awareness, I think it's important for us to be very self-aware. Using person first language it's such an important part of reducing the bias and stigma out there. And when I say that, what I mean, I'm sure, but when we identify people, we should describe it as person's living with obesity, rather than we often hear people describe, unfortunately, someone as an obese person. And we really discourage using that language because it dehumanizes
Right.
us. We
And we
don't
can do
define
that
people
to
by their
ourselves,
condition.
right? Like
Hmm.
sometimes people refer to themselves as, I don't use the F word, the 3-letter F word. But they'll be like, oh, I'm fat, or oh,
Hmm.
and so we can internalize that too when we don't think of ourselves as like, no, I'm Sally and I also struggle with my weight, right? Like they're separate things. It's not your whole identity. So yeah, that patient first language, we
Right.
call it in medicine, but even not identifying ourselves solely as that way and maybe calling people out, if they are
Hmm.
identifying us that way. Yeah.
Yeah, increase your awareness of how you speak about yourself, others, and not be afraid to act and point out and educate others, that they may not be as aware of the stigma and the bias that they may be participating in.
Well, thank you so much, Dr. Golden. I think that gave hopefully our audience a lot to think about in terms of that internal bias that we often have about weight and what's good or bad, judging ourselves too much, limiting ourselves, limiting others based on what they can do with weight. And then we talked about I think this really important topic that to me feels at the core of these medications, which is coverage. People deserve access to these medications, but we are going to have to take some individual action to make that happen because no one is more motivated than the person who needs the medicine, right? So if you are finding that you can't get this medicine, like utilize these tools, talk to your HR department if you have that ability. And we're going to put that link on there where you can submit a letter super easy to your congressperson or representative to, work on a bill that would help support this. So thank you so much, Dr. Golden. And until
Thank you.
next week, everyone, take care. Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.